Greetings and welcome to Your Brain Health. This is actually our fourth in a series of webinars about women's brain health and risks for dementia. If this is your first webinar, thank you for joining us. If you are a repeat customer, thank you for coming back and joining us again today. And I think we can still say Happy New Year, so happy 2023 to everyone. Bonne année à tout le monde. 1 year ago, we launched this initiative, again in January, as part of our programming for Alzheimer's Awareness Month. And so we're back a year later with the fourth edition. And before we go too far, I just want to do a little bit of housekeeping, the requisite housekeeping. So there it is. Just to inform you that this webinar is being live cast on Facebook and recorded for future on-demand viewing, which means, yes, we will send you the link to this after the event. Everyone except our speakers and event coordinators are muted today. We encourage participants to pose questions in the chat function of either the Zoom web application or on Facebook comments, and we will do our best to answer them at the end of the webinar. For your privacy, please do not share personal health information. And any medical information shared in this webinar is an information resource only. It's not to be used or relied upon for any diagnostic or treatment purposes, and the information should not be used as a substitute for professional medical advice, diagnosis, or treatment. My name is Kate Holmes, and I'm the Director of Development and Education here at the Dementia Society of Ottawa and Renfrew County. And just a little bit about us, if you don't know us. The Dementia Society is a charitable organization. We are funded in part by the Ontario Ministry of Health to provide support specifically to caregivers of people impacted, people diagnosed with dementia in Ottawa and Renfrew County. We also fundraise to develop and deliver a wide range of programs, social, recreational programs, and awareness programs like the one that we're doing tonight about women's brain health for people in our community. And as dementia numbers increase, more programs are required as well as funding to deliver them. So if you think that the work we're doing is important, please support us, and you can do that through a financial contribution or as a volunteer, volunteering your time, compassion, and expertise. The numbers are increasing, and the latest information that we have, so currently in Ottawa and Renfrew County, there are 24,000 people who are diagnosed with dementia. We say it often, but what we haven't yet had the chance to say is the new projection is that there will be 60,000 people diagnosed in 2050. So this is an illness that is on the increase. It is an umbrella for many illnesses, which include Alzheimer's and many more. And the latest statistic, and the reason these next two are in green, these are really the insights or the inspiration, if you will, for this women's brain health program. So 61.8%, to be precise, of people living with dementia today in Canada are women. So women are diagnosed over the age of 65, 2 to 1 compared to men. We've said that before on this series, but if you haven't heard that, we still think it's a very compelling and important fact to take note of. And 1 in 5 Canadians has experience caring for someone living with dementia. And the reality is that many caregivers, most caregivers, with no disrespect to any men who are also doing this, but most caregivers are women. So we feel that it's safe to say that dementia has a little bit faint, is a list of what are called modifiable risk factors for dementia. So this means that up to 40% of dementias can be prevented, essentially through modifying one's behavior. And our Women's Brain Health Initiative is in fact exploring these. So I said this was our 4th edition in this series, and we have talked previously about sex differences, nutrition, sex differences in dementia, nutrition, and brain health and heart health. And if you look down this lovely chart, you'll see that later in life, depression is a really significant factor, risk factor for dementia. In fact, it says the increased chance of developing dementia compared to someone without this risk factor. So experiencing depression over the age of 65 is a 90% chance of developing dementia. And that brings us to tonight's cheery topic here. is stress and depression as risk factors for dementia. So we're really, really delighted that we have Bonnie Daros and Mary Prince here to tell us about this tonight. They'll obviously tell us about what stress and depression are and how they affect some good scientific facts and studies that they'll share with us, and more importantly, a lot of very practical information, because that's something that we pride ourselves on at the Dementia Society, is being very pragmatic in the advice and the care that we provide. So I'm not going to say a whole lot more than that. I'm going to hand the reins over to Mary and to Bonnie by stopping sharing my slides and handing it over to them.
So welcome everyone, and thank you so much for joining us this afternoon. My name is Bonnie Daros, and I'm an outreach nurse from the Royal Ottawa Mental Health Centre. This is where I'm based. I have two roles. My first as an outreach nurse is I go with a geriatric psychiatrist. We're a team that go to a long-term care home, and we provide recommendations to the residents there and to their families. And then my other role is as a psychogeriatric resource consultant, and I provide education and support to the staff working in the 29 long-term care homes here in Ottawa. I've been at the Royal for about 13 years, and prior to that, I worked at the Purley Rideau Veterans Health Centre, first as a healthcare aide and then as an RN, so about a total of 18 years there. And I've also been a family caregiver for a father-in-law who had vascular dementia. Mary?
Hi, everybody. My name is Mary Prince. I'm a registered nurse, and I work for the Pembroke Regional Hospital in Renfrew County. I work for the Geriatric Mental Health Outreach Team, and I'm also the Psychogeriatric Resource Consultant. So I also have a dual role like Bonnie. In Renfrew County, our Geriatric Mental Health Outreach Team serves the whole county, people living in long-term care, retirement home, hospital, as well as their private homes. We're a team of nurses and physicians, and we do consults and assessments, and we also provide behavior support. Yes, so I've been nursing for 30 years, and about 20 have been in geriatric mental health. So I'm happy to share some information with you today.
Great. So just before we get right into the presentation, we're going to be doing a practical strategy a little later on. And I just want to give you a heads up that if you want to join in with that, you'll need a paper and a pencil or a pen. So I'll just throw that out there now. So first, we wanted to share some of the research and statistics on depression, stress, and dementia. And then a little later, as I mentioned, we'll look at the strategies. So certainly when Mary and I were doing research, some of these stats we really felt for ourselves, and you may feel the same, were kind of life-changing for us. And we're going to talk more about some of those strategies to even make the smallest little change. We'll talk about that later. So there's a position paper here on our slide, was called Every Door is a Right Door. And from that paper, we learned that 1 in 5 Ontarians have a mental illness or addiction. Most common mental illnesses and addictions in Ontario are anxiety, depression, and alcohol dependence. For women, they're more likely to suffer from anxiety and depression, whereas men are more likely to struggle with addictions. Some Ontarians are particularly vulnerable to mental health and addictions, including people who struggle with poverty, homelessness, and who have had experienced trauma, violence, or abuse. Switching the focus to seniors, 10 to 25% of seniors experience mental health disorders, such as depression, usually related to medical illness, disability, and social or emotional isolation. Seniors are at high risk of both mental illness and problematic substance use during critical transitions in their lives, and we'll talk more about that as well. This might be the loss of a partner or spouse, or caring for a partner or spouse with dementia, or even moving to a long-term care home. I'm sure some of you have seen this statistic as well in the past. By age 80, dementia affects 1 in 3 people.
So we just wanted to talk about depression and stress. So first, depression is not the same as sadness. So we can all have down days, feel sad at times, and depression can be triggered by a sad event or sadness. However, it's not the same. Depression affects thoughts and feelings and is a treatable mental illness. And it's a biological illness caused by a chemical imbalance in the brain. So we just hope, everybody on the call just understands that it's a medical illness. It's not just pull your socks up and you'll be fine or a sign of weakness. It's a medical illness, the same as diabetes or hypertension, and it's often treatable. And it can also affect our well-being, whereas stress is the body's response to a real or perceived threat. So it's a situation that becomes overwhelming, and it's helping us get ourselves out of danger. Stress is a reaction to a situation, not the situation itself. So, the same event can happen and two people can act totally different. It depends on the person. And so we're going to talk a lot about stress today. So depression in women, as Kate brought up earlier, the stats are alarming. Women also have a two times increased risk of depression as compared to men. And women also report greater illness severity, more symptoms and different types of symptoms than men. So there's a lot of studies going on, a lot have been done, but hormonal factors may be one risk factor. And women's hormones change frequently throughout life, which includes menstrual cycle, pregnancy, postpartum, if they've had a miscarriage, the years leading up to menopause itself, and then of course postmenopausal. Also studies that show, the stress of caregiving, and women also have workloads in the home and outside the home, and they're often the manager of the family, and often can become caregivers for their children, maybe their spouse, maybe their own parents. So this leads us to the relationship between depression and cognitive impairment. So again, a lot of research has been done and a lot is still going on, but we do know that depression can be a risk factor for dementia. And it makes sense, when we say that depression is a medical illness, it's an illness of the brain. And so definitely it could put us at risk for another illness. Depressive symptoms at baseline among postmenopausal older women are associated with a higher incidence of cognitive impairment. So like what was already brought up, if you have a late life depression, it is often recommended that you get cognitive screening regularly. So we would want to talk to our doctor about that. People with dementia are also more vulnerable to depression, and they have a vulnerable brain.
So talking a little bit about late life depression, the diagnosis and identification of depression can be a challenge at all age groups, but particularly in seniors, leading to underdiagnosis and misdiagnosis. Common barriers to that identification and assessment can include communication limitations such as hearing impairment, or maybe the presence of dementia or cognitive impairment. And this can sometimes interfere with accurate reporting of those depressive symptoms and their duration. And so certainly Mary and I, when we're in our outreach nurse role, we're of course talking to the person themselves, but then speaking to family and other staff who are supporting the person on a daily basis. Depression in late life is associated with significant functional decline, family stress, greater risk of medical illness, reduced recovery from illness, and premature death from suicide and other causes. So sometimes we might use the word depressed often, we say I'm depressed today and that sort of thing. And we just wanted to talk a little bit about maybe major depressive disorder, what is the difference there? And here are the symptoms that we look at. We need to have about 5 or more of these symptoms that have been present over about a 2-week period. And they represent a change from previous functioning. So we see depressed mood, There may be a decreased interest in interest or pleasure for things I love to do usually. So that person who looked always forward to family visits or going to music programs or out in the garden on a nice day, they don't want to go, they're not interested in that baking program, for example. They get to the music and they just can't stand it and they need to leave. So if people are noticing a change there. Weight loss or weight gain can happen, but certainly Mary and I notice in seniors that we're supporting, often it tends to be more on the weight loss side. We're always really taking a look at people's monthly weights. We're asking them about their appetite, but also looking at the documentation on appetite. And I think there's really, you see a real connection, and probably some of you can reflect on this yourselves, that connection between the brain and the gut. You know, and I know that when I'm nerved up or stressed out about something, worried, that you can sometimes feel it in your stomach, right? A real pain, a real like pit in your gut. Maybe you can't even eat. I know my girls who do competitive dance, sometimes when they're, you know, stressed, they feel like, I can't eat anything today. I'm before I dance or whatnot. So that connection is there. So being aware when someone's making a lot of complaints about their stomach, absolutely, that has to be checked into. There could definitely be something wrong with the stomach, but being aware that those complaints of bowels is something we see fairly often. Changes in sleep, too much sleep, or actually not being able to fall asleep, or falling asleep but not being able to stay asleep, those kinds of things. Restlessness. You may see fatigue, get up and go as got up and went. Just don't have the energy to do things they enjoy usually. Guilt, worthlessness, maybe comments like I'm a burden to others, maybe people would be better off without me, those kinds of things. So those recurrent thoughts of death or suicidal ideation, and decreased concentration, finding, you know, I've read the same page 3 times, I'm not taking it in, I'm not remembering those things. And that's again why it's so important to check with your physician. Depression can look like dementia at times, and Mary's soon going to talk about treatment. So always making sure that you're checking in with your physician. So just a little bit about what are those predisposing factors for depression: being female, widowed or divorced, previous history of depression, brain changes, major physical or chronic disabling illness, being on multiple medications, excessive alcohol use, social disadvantage and low social supports, and caregiving for a person with a major disease, for example, dementia or perhaps cancer. Those precipitating factors: recent bereavement, major life changes like a move, perhaps it is to long-term care. And, that's a major downside. Some of the homes are smaller for sure and can't bring a lot of your belongings. Maybe the loss of your partner, living with them on a day-to-day basis, or being able to bring your pet with you. So major change there. Adverse life events, concerns about finances, for example. Chronic stress with declining health, family or marital problems. Certainly in the last 3 years with COVID, haven't we seen major social isolation playing a part? And I'm sure we're going to see lots and lots of research studies coming out on that subject. Persistent sleep difficulties.
So that leads us to just briefly discuss treatment. First, I just want to highlight that Bonnie and I are both RNs, and so we will not be talking about specific medications. And to get more information on medications, it would be great to talk to your family doctor or nurse practitioner. So treatment can include improving one's lifestyle, social supports, counseling, therapy, and of course, medication. And, it's not one size fits all. Some people, find that lifestyle changes help. And I just want to bring to the attention the latest research, or the research that's been ongoing about exercise and mood symptoms. And exercise itself has shown to really help with mood symptoms from the release of endorphins. So that can be really helpful. And as well as exercise helps improve circulation to our brain, so it helps us with cognitive changes as well. And when we look at medications, it's important to note that it can take medications up to 4 to 6 weeks of becoming effective, so or seeing results. So the message is, if you have a loved one or yourself that's going through this and started a medication, you still need ongoing support, ongoing exercise, social supports, counseling, etc. We really need to be closely monitored. Sometimes the person's depression is so severe that medications and therapy don't do the job, and we can look at other treatments like ECT, which is electric convulsive therapy. We still do that. It's done quite safely, and it's shown to be quite effective in treating mood symptoms. Research is promising when we look at stress and depression. If we can treat them, so if we treat the illness of depression with antidepressants, we can reverse the anxiety and depression. It's definitely treatable, and that also will help us improve our cognitive impairment or our risks for cognitive impairment, which again makes sense. If you have one illness in your brain, you could be more susceptible to another. So like I said, it's not just pull your socks up and you're fine, get out of bed, you're good to go. It's really important to ask for help. When treated quickly and properly, more than 80% of older adults with depression can be treated successfully. So how can we support the person experiencing depression? First and foremost is safety, ensuring they're safe, they're not isolated, they don't have suicidal thoughts. If they did, we would have to act immediately and either take them to hospital or talk to their physician. Making sure their family doctor is aware what's happening and they might be seeing a specialist, ensuring they're getting food and fluids, sleep and wake patterns, and sometimes they just need you to listen. Talking about positive past events and fostering hope is a great intervention for depression. Helping them see the light, encouraging independence, and improving lifestyles such as social support. So, educating ourselves, learning more about it. There's lots of home care service, community-based programs. We have some great community mental health programs and support groups. And again, exercise. We like to highlight the exercise. And also individual and family counseling, different types. And we just wanted to pull this all out to say, there's so many things out there, and one person, might find animal therapy or music therapy is helping them with their mood. There's peer support groups, mindfulness, reminiscent groups, psychotherapy. So there's a lot out there. And touching base with your family physician or nurse practitioner or Dementia Society, community mental health program, they might be able to navigate you for these resources. Great. So now we really wanted to focus on, because we know you've had previous seminars dealing with, the cardiovascular risk factors, and you talked a lot about other things, but we really want to focus on stress today and the impact that stress has on our brains. And like Bonnie said, the stats we pulled were life-changing. Even though we've worked in this for so many years, we were both like, okay, we better get a handle on things. So a stress reaction can actually, we release cortisol, which is a steroid hormone. And some studies suggest that this causes damage over time. So increased cortisol over time can cause atrophy or death to the hippocampus in the brain, which causes memory decline. And there's the link that we could be predisposed to dementia. And so the hippocampus is responsible for consolidation of information from our short-term to long-term memory. And it's also helps with spatial memory, navigation. So it's very important. So stress can actually damage it. The stress response can also increase cytokines, proteins in the brain, which again increases the risk for depression. There was another study about midlife stress can enhance tau pathology and brain atrophy, and we know that an increase in tau proteins puts us at risk for can be a sign of neurodegenerative disease such as Alzheimer's. Psychological stress in adulthood is associated with an increased risk of dementia. So there's a lot of information out there how important it is for us to manage our stress. We wanted to throw in a couple of stats about loneliness because we know the pandemic has been so difficult for everyone. And loneliness is associated with depression and dementia as well. There was a survey by Stats Canada in 2012, so many years ago, reported that 20% of older people in Canada declare feeling lonely. Imagine if they did that study in 2023. And, you know, we were so busy in our programs with mental health over the last few years and how this pandemic has affected so many. So, you know, we really should be aware of how loneliness can affect our brain in itself. So Bonnie found this little picture and we both had a chuckle and, you know, we both could relate. It could be mom, dad, or anyone, but it happens to be mom getting ready for Thanksgiving, who looks like the angry dinosaur, and then mom when people arrive, right? So some of you might relate to this or a similar event where we're overwhelmed with something and then we get it together and it's, you know, we can present totally differently. So we just want to take you through this exercise. So I'd like everybody, we're going to do a mindfulness exercise. I would like everybody to close your eyes and think back to a recent event where you felt overwhelmed. All right, like this picture, getting ready for Thanksgiving dinner. It could be even just, you know, you were going to a special event and you wanted to feel and look your best. Or even just heading to the grocery store in a busy season with a long list. For each of us, there will be different events and different stressors that cause a reaction. All right, so I just want you to think about it. Take yourself back to a stressful time. I want you to think about that time. Think about the way it made you feel in terms of your mood. Did you feel angry? Did you feel irritable? Did you feel sad? Perhaps your feelings didn't change at all. Your mood was okay. What about your physical symptoms when you were feeling overwhelmed at this event? Did you feel changes in your body? Some people describe butterflies or a pit in their stomach. Did you feel your heart racing? Did you feel short of breath or did your breathing change? Did you get shaky? Now I want you to think about your thinking or cognition. Did it change? Did you have trouble focusing, trouble with concentrating, difficult finding words when everyone was trying to talk to you, difficulty processing your thoughts? Now, lastly, I would like you to think back about your behavior during this time. Did you become angry? Perhaps did you raise your voice? Or did you cry? Did you act out, maybe slamming a door? Did you leave the room? Maybe you locked yourself in the bathroom. Did you just stop the task you were doing and say, forget it, I'm out? Take a few minutes to notice these changes you may have felt. Now you can open your eyes. And the exercise was for you to reflect on what can happen to us, our mind, our body, our behavior during an overwhelming or stressful event or situation. We are all different. There is no right way or wrong way, but being mindful when these situations become out of control, they can alter us, our mind, our body, our behavior. Thus, what the research showing can lead to disease.
So we wanted to share this concept of the window of tolerance. And I thought I might share an example from my own life that happened not too long ago that might help to explain this window of tolerance. We have this green zone we live in. We call it sort of the sweet zone. And then we can sometimes go into yellow and even red, hyperarousal or hyperarousal. So recently, I actually was going to the cottage. My son was coming with me, and to make a long story short, I thought, let's stop at the gas station before we head out, and I'll pay for your gas. And so we stopped at the gas station, and he pulled up to the pump, and I pulled up beside him. Now, granted, where I pulled up beside him, I was blocking an area. There was at least 2 or 3 other ways to get out of the gas station, but where I stopped to jump out of the car to give him my bank card, I did block it there. But in that 1 or 2 minutes that was happening, a couple in a van went hyperarousal. So they went out of their zone right into hyperarousal, rolled down the windows, started screaming at us and swearing and saying, "Mommy, doesn't your son know how to pump his own gas?" And they just really peeled out of the gas station. And both Cameron and I just luckily didn't go into the hyperarousal. You know, in that moment, we stayed in our sweet zone. We just looked at each other and thought, oh my goodness, maybe because we were headed to the cottage, maybe because it was 7:30 in the morning, for heaven's sakes. But that couple really went into that hyperarousal. So this can happen to us. And, you know, the window of tolerance refers to that zone that we live in. We have modulations, of course. We can go up and we can go down a little bit. And that green zone for some of us is quite wide. There's research showing that people who do a lot of yoga, exercise, meditation, relaxation techniques, and don't have a lot of stress may have a larger window. Whereas other people, research is showing where they found to have had significant childhood or other traumas may have a smaller window. So we all need to understand what our warning signs are. The truth is, many of us live with stress, but we don't always notice it. So Mary invited us to sort of reflect on our warning signs. What are your top 3 warning signs that you have that are showing you that you're starting to exhibit or tell you that you're headed towards that red zone? So now I'm just going to go over a few of those symptoms to look at. So physical signs. What is it for you? How is your body letting you know? Is it the headaches you get? Is it the eye twitch? Is it your shoulders? Just you feel like they're hard as a rock. You're just holding it in your shoulders there. Feeling unwell and exhausted. I know for me, I'll get a cold sore right before the holidays, and that's my body's way. Of course, then I look beautiful for all the pictures. That's my body's way of saying, Bonnie, it's time. You need to slow down a little bit here. Perhaps it's the emotional signs and symptoms, withdrawing from others, being down on yourself, negative self-image. Perhaps you find yourself being a little bit not feeling that sympathy and empathy that you normally do for others, resentment. And that leads me to this one, what we call the must be nice phenomenon. And maybe you've seen this before. And this can happen when we have a negative reaction to other people's self-care strategies. Maybe you've done this. Someone says to you, you know, my partner does all the cooking. And you think, must be nice. We just paid off our mortgage. And you think, must be nice, you know? So what does it really mean? Having this reaction usually points to longing or envy on our part. We'll talk a little bit more near the end, but this must be nice reaction. When it happens, it's like it says here, notice what you are feeling. Pause and take a deep breath. Check in with yourself. Am I envious? Is there something I'm yearning for? And then that smallest possible change, which we'll talk more about at the end, adjusting. What can I do, even the smallest thing, to make a change? What could it be? Let's look at our behaviors. What about my behaviors? Those behaviors that point to me moving from that green namaste zone right into that yellow or even maybe the red. Are you drinking more alcohol? If maybe you're smoking, usually half a pack, it's a pack and a half, 2 packs, really increasing, angry, irritability, decision fatigue, being snarky or sarcastic with others, missing work, for example, or even compromised care for people around you. So here's another strategy that Mary and I wanted to share. It's called the power of the pause. So it's really important to pause and reflect on what is the lens that I'm seeing the world through. When we pause, we can start to notice what is happening for us, our body sensations, and our thoughts. So I'll give you an example of something a friend of mine shared lately, and I thought it really brought home the point, was you ever walking down a sidewalk on one side, and maybe you see a friend on the other side of the sidewalk, and you wave to them, and they don't wave back. So lots of things can happen there, eh? There's many possibilities. There's many thoughts that can occur. One thought might be laughter, and just like, oh my goodness, I can't believe she didn't see me. I'm going to text her right now. What? Are you blind as that? I just was waving at you. Happy emoji. Off you text them, It can go in that direction. Or it can go sometimes in another direction, can't it? Where our mind starts to think, wow, isn't that ever rude of them? I wonder why they didn't wave back. Have I done something wrong? I don't think I've done anything wrong. Is she angry with me? And so you can go down that sort of rabbit hole. And the power of the pause really looks at, why not choose a thought that is beneficial to us? These questions may help that we put on the screen here. Do I need to bring so much emotion into this? The problem is we get stuck in rumination, and we keep feeding the emotion with more negative thoughts, and we allow it to bother us for far too long, and it stirs up that emotion and stress, and we've seen that it's unhealthy for us. Asking ourselves, what is in my control? What can I learn from this, etc.? If a situation happens and you really can't think of anything positive to say to yourself, ask yourself maybe, what is the kindest thing I can say to myself in this moment? Or maybe, what if it was my best friend? What would I say to my best friend in that moment? And say it to yourself.
Okay, we want to do another exercise. Bonnie had mentioned for you to have a paper and a pen. And so what we want you to do, this is an exercise from the TEND Academy, Francois Mathieu. It's called What's on Your Plate? So we want you to draw this circle, a dinner plate, not a dessert plate. A good sized plate on your paper. Well, some of you might only need a dessert plate, but on the dinner plate, I want you to write in the middle, inside the plate, all your responsibilities, including your jobs and roles. So caregiver, parent, spouse, student, nurse, doctor, construction worker. I want you to write all that in the plate. Your responsibilities at work and at home. Any current stressors that are happening. So if you're caregiving for someone or you're preparing for a big exam, any current stressors. So I'm going to give you just over a minute to fill your plate. So your roles, your responsibilities at home, at work, and any current stressors going on. Okay, many of you have filled your plates or filled out your plates. Now I just want you to look at everything in your plate. Underline the things that you may want to change in that plate. Not that you can change, but underline the things that you would like to change. Now what I want you to do is circle the things that are changeable now, even if it's only one thing. Some of you may not be able to circle any, but circle the things that could be changeable now. That you could, I don't know, if you had laundry in your plate, maybe you could delegate it to another member of the family. Circle the things that you think you could change. We know that if you're caregiving for someone, it's very difficult, and that you might not be able to change anything right now, but it's sort of to help you reflect on things that you would like to change and how we could go about doing it. And then on the outside of the plate, I want you to write things that you wish you had more time to do or enjoy. So things that, you know, you like to do and you wish you had more time to do them. So hanging out with friends, exercising, going out for dinner, things that you'd really like to do and you wish you had more time for could go on the outside of the plate. Then we just want you to ask yourselves, what barriers exist that prevent you from doing them? Is it just exhaustion? Is it because you are caregiving? We want you to explore those barriers. And then we want you to look at that plate and think about one thing that you could change or say no to. So that you're able to do the things on the outside of the plate. And so we'd like you to keep those plates and work on them. And, you know, some aren't realistic that we can change, but some are with support and help. Thanks.
So as our last strategy for the end of the topic today, Mary and I thought we'd like to share this grounding technique with you, and it's called Feet on the Floor. And the reason we chose this one is that it's very simple. It can be done anywhere. And I know that some of you on the call might be very familiar with mindfulness. Maybe you've been on retreats, you've got your apps that you listen to, you've been to courses, and for others it might be brand new for you. So I challenge you to give it a chance, to give it a try a few times to see if it'll work for you and something that that is successful. So I'd like you to get comfortable in your chair. You can either do this seated or you can do this standing if you like as well. And, you know, once again, because it's so simple, it can be used if you're anticipating a stressful event. You could do it before, you can even do it during, or of course, even after. So when doing a reflection or getting a sense of what is going on in the body, it can be helpful to close your eyes or to sort of adopt a soft gaze. And so I invite you to do that now, to gently close your eyes now and adopt that soft gaze and/or move your awareness into the soles of your feet, placing your full attention into your feet. Noticing the points of contact with the floor. Noticing the distribution of weight. Now maybe gently moving back and forth. And noticing the changes in sensation in the feet and distribution in weight. You may want to move side to side and just notice the changes that occur. Very subtle changes. You can make circles with your knees and notice what happens as you do this. You may notice that your mind wanders off in thought. That's okay. That's what the mind does. Once you notice that happening, bring your focus and attention back to the soles of your feet. Noticing your feet anchoring into the floor. If you like, you can take a step or two forward slowly. Noticing what happens with the sensation as you lift one foot and step forward and place the foot on the floor. Noticing the distribution of weight. You may want to take a step back and notice how that feels. Notice how small the surface area of your feet is. You may even feel some gratitude to your feet and all the hard work they do. When you're ready, you can release the focus on the soles of your feet and gently open your eyes and refocus into the room. Notice what is here for you now. So, as we said, we know that stress is unhealthy. So this is a little easy strategy that you can use to help you stay in that green or yellow zone, or to bring you back into the green or yellow zone.
So finally, making a commitment to change. It can be difficult, but sometimes to make lasting commitments is to share them with someone who will gently but firmly hold you accountable. Consider sharing the commitments with a friend and having a review within a few months. You've seen all the research and how stress can put you at a greater risk for dementia and affect your quality of life. So practice, practice, practice. Start doing, continue doing, never stop doing. Thank you, everyone. Oh, one more slide, sorry.
Yeah, so just to close, we thought we'd share this quote from the Dalai Lama. For someone to develop genuine compassion towards others, first he or she must have a basis upon which to cultivate compassion. And that basis is the ability to connect to one's own feelings and to care for one's own welfare. Caring for others requires caring for oneself. So that concludes our presentation. I'm going to stop share. Thank you, everyone, for your time and attention. And I believe the moderators are going to look at some questions, perhaps.
Here we go. Just try and get the right slides up. That's working. There we go. And then I think I have to flip something. Let's see if that works. Am I showing the right stuff now?
Yes.
Yep.
Great. All right. Well, thank you so much for that. I feel very chill after that exercise. And I really love that you have, well, first of all, I'm very grateful that you've taken the time to prepare research and to present to us today and to share all this great information. And I think the important thing, there was a lot of heavy stuff in there, but one of the most important things is that this is something that we can do something about. It's not always easy, but it does take practice. And I think you've given us a number of ways to do that. And I just wanted to remind people before we head into the Q&A that the Dementia Society does provide a number of education programs about brain health, as well as dementia. If you're a person living with dementia, you are curious about dementia, you're a caregiver for someone living with dementia, all the way from brain health through grieving, end of life care, and everything in between. And there's a very rich life in between. And I think one of my colleagues shared some information. Someone had a question about grieving, and we do have a support group specifically for that. On the activity side of things, this is just a snapshot of our website. If you go to dementiahelp.ca and you mouse over any of the top menu items, for example, here, activities, support and services, you'll be able to see the different types of programs that we have available. So a lot of the activities that are good for your brain, exercising, music, art appreciation. We have lots of free programming in this area, as well as a number of support groups across Ottawa and Renfrew County. So I invite you to please have a look at our website sometime. And just to let you know about another program coming up, we have at the end of Alzheimer's Awareness Month, a live expert panel on the 31st of January at 5 p.m. And we have right now 4 specialists, experts, a cognitive neurologist, a long-term care specialist, spiritual and mental resilience expert, and one of our own dementia care coaches who will be available to answer questions live. And we're inviting you to register. And you can also submit your questions in advance here, and we will do our best in this 1 hour to answer as many of your questions as possible on this broad range of topics. It's still coming. The Q&A is still coming. So I know we have some questions that were posed in the poll. If you do have a question, we're going to keep everybody muted. You should still post your question in the Facebook chat or on the Zoom chat. We're going to do a quick poll because, as I said at the very beginning, if you recall, this program, or this series has been informed by what people are interested in around dementia risk in particular, but we're open to broad topics. So we're going to pop up a poll here with some quick questions. And if you would do us a favor and just answer the questions, we're asking you a little bit about, did you learn something you think you can use today? And your general awareness of risk factors, as well as what healthy habits you currently practice around brain health, and topics, the all-important topics for future subjects. So I invite you to do that. And to let you know that if you don't know all the topics that you'd like to know about, you have another chance, because tomorrow we'll be sending you a follow-up email with a link to this webinar, today's webinar, and also another quick survey, a little bit about you and what your thoughts are around this program and future topics. And you could win a Dementia Society toque with this nifty daisy that you can see in our logo right on the toque, so that you look cool when you go do your shopping or buy your son gas at the local gas station. Are we good for the poll, Herman? Can we move on? So the question and answer.
It's still running, so let's wait a few
We can
seconds.
still run it, and I'll just talk, and then we'll just get to this. So the question and answer, we talked about posting the questions in the chat. Vous pouvez également poser vos questions en français, et on fera de notre mieux pour vous répondre dans la langue de votre choix. I was taking note as questions were flying by, and we had some interesting ones. And so I'll put them to Bonnie and Mary, and we'll do our best to answer. A few we might be able to chime in and hear from the Dementia Society. So one of the questions we had was, does depression always lead to dementia? either of you care to address that?
You're on mute, Mary. Did you want to?
Sure. So that's a good question. And, after that talk, if you have depression or know someone, you're probably like, oh my goodness. But it is a risk factor. It does not always lead to dementia. And so I think the big message is to try to make sure it's managed well. You're doing self-care, and you're talking to your doctor or health professional about it. Trying those lifestyle changes and treating it, because treatment has shown if you can reverse it in your brain and treat your brain, then hopefully it'll prevent another illness like dementia. But it is a risk factor, yes.
Doing your best to sort of widen that green zone, and so that you're more resilient for those times to come back to baseline more quicker, because I think there's always going to be things that happen where you become hyper-aroused or hypo-aroused, and how to more quickly go back into that green zone when something like that happens. I mean, we live in Canada, it's freezing rain, you're on a busy highway, it's the 401, there's big trucks passing you, and you're feeling it. How do I get back into that green zone? And so the research is really showing, as we said, that those strategies, have a couple of that we shared with, but mindfulness, yoga, relaxation, all of those things can be helpful to widen that green zone for you.
Great. Practice. We've had a couple of questions around sort of linkages and whether this is hereditary. So if an individual has been diagnosed with or has depression and their parent has dementia, are they also likely to develop dementia? You might need a flow chart.
So you're at if a parent has age-related dementia, so it's from aging, so after 65, you do have a very small increased risk, but I don't want to say a stat because I'm not exactly sure, but it's a very small increased risk if they have age-related or vascular dementia. But we definitely know that, there is a risk. And so again, it would be, all the brain health that we talked about. It's not as risky as the younger disease, the younger dementias. You have a very increased risk for some of them, but age-related disease, it's not necessarily a huge risk. It's not like a 50% risk, but there is a risk. And we always ask about that, when we're doing assessments if family members have the disease.
Somebody is asking if there's any testing available to know whether there's been damage to the hippocampus and if it can be reversed through mindfulness, etc. I think it's sort of a pharmacological or not question at that point.
I don't have the answer regarding mindfulness. Actually, I'd have to research that and look that up, or sometimes what we do is we connect with some of our geriatric psychiatrists to see. I know there is some incredible scanners. I don't know at this point if they're really open. There might be more for research, not necessarily to the general public to have that kind of testing done here, but there's so many changes going on that I could be wrong about that. But I know there's a big scanner here at the Royal where lots of research is being done, but I don't believe so at this time, but that's something that we can check on for sure. Mary, do you have anything else to add?
There's a lot of research on brain neuroplasticity, so rejuvenating our brains, and so you might want to look that up. And again, it's focusing on things like lifestyle changes and mindfulness, all this stuff that's really, hit out there today. Exercise, mindfulness, self-care. So, and doing those brain games and things like that. So you might want to look into that, research that.
They often say too, Mary, that, learning something new, not just like, for example, deciding I'm going to start to learn to play guitar, or try to learn the piano, not so much just only listening to music, but learning something new. They talk about even driving home a different way, because sometimes we get into that mode where we don't even need to think. Suddenly you think you're on your street and you're, how did I even get here? I was going to go to Loblaws, and here the car seemed to magically drive its way home, and so we don't even have to think about it. So making the conscious decision to go a new way, try a new thing, can be helpful too.
Great. We had a feeling this might come up, and this is around, you talked about going into long-term care homes, and people are asking, is there a similar service available to people in private residences?
Oh, like retirement homes. Yeah, so in Ottawa, Mary can speak to Renfrew County, but in Ottawa, it's sort of split. So the Royal provides service for the long-term care homes. So our team, we have nurses and psychiatrists going to each of the homes here in Ottawa, and for the community, so retirement homes, private residences, it's the Geriatric Psychiatry Community Services of Ottawa, their team, so GPCSO is what they're often known as. And then Mary, for your area?
In Renfrew County, our team serves all areas, so long-term care, retirement, hospitals, as well as the person's private home. So we have outreach nurses for all areas of the county.
Right, but to access your services, we can't just call you up, right? There's a process.
It's physician referral.
Right.
Yes, so you have to talk to your family doctor or nurse practitioner. We do accept referrals from nurse practitioners. So if there's a clinic, if you don't have a family doctor, and we need a physician referral, yes.
Right. And so if somebody is looking for one of those referrals, maybe doesn't have a doctor or needs help, the Dementia Society can help you with that, sort of to help you through that process and get that referral. So please don't hesitate to contact us at dementiahelp.ca. Somebody's asking, will it be possible to have the power of the pause available to print? We talked about maybe having some of these tools pulled out of the presentation, so everybody will get a copy of the presentation, but we're looking at how we might be able to create these as standalone useful pieces, so we can all start our meetings with a grounding exercise, for example. So stay tuned on that, but you will get the link to the webinar. This is a really big one, and maybe we want to end on, I'm not sure, but how does childhood upbringing affect your ability to cope with stress?
Wow, that's a good one.
It's a big one. Yeah.
So that's a whole other topic, but Bonnie and I just became TEND Academy trainers. So a lot of our activities there were from the TEND Academy. And there was a lot of talk that childhood trauma they're risk factors for stress and depression as we age. So I don't have all the stats, but definitely, Bonnie, do you remember offhand? There was a whole segment.
There was
on
an excellent
trauma.
TED Talk, remember, Mary? And I'm
yes.
a physician who did that TED Talk, but her name is not at my fingertips right now, so we can share that with Kate.
Yes.
And maybe you could provide that as well, because that really talked to that issue, that exact question, and it's an excellent TED Talk, so I can look that up.
Great, thank you. My best friend's family doctor is not comfortable doing cognitive testing. What are my options to have her tested?
I would think asking sorry, go ahead, Bonnie.
No, go ahead, Mary.
Just asking the physician that isn't comfortable if he could refer them to a specialist, or there's many geriatric teams out there. So depending on the area, he could refer them, or she could refer them to the specialty team. Bonnie?
Yeah, to the geriatric, the GOAT team, as they call it, the geriatric assessment team, or connecting again, as Kate said, if you're not sure, to connect with the Dementia Society, and they can maybe point you in the right direction there.
Yeah. Just send us a note, info@dsorc.org, or it's right off our homepage. There's a chat. Somebody will respond and do an intake and figure out how best to navigate with you. I know it's a couple minutes after 6, so we've gone over our time, but I'm just going to grab one last question. Maybe we got most of them, but there was one that might be a bit. Can stress cause lesions in the frontal lobe? Just as a closing.
I actually just saw some research about that. So I don't have, you know, all the information about it, but I think the message is that it can hurt the brain. And we talked about the hippocampus, but I did see there's some papers about the frontal lobe as well. So it's really important to take care of our brains.
And I think that's a perfect place to end. It is really important to take care of our brains. So thank you very much to everyone who joined us tonight. Thank you especially to Mary Prince and Bonnie Daros. I'm very grateful to you. I think these are great practical exercises, and we will do our best to make them available to everybody who was on the call and beyond. Thank you very much for joining us. We will be in touch with news of our next session in the coming months based on your feedback. Thanks very much, everyone. Take care of yourselves.
Thanks, everyone. Take care.
Thank you. Thank you.
Thanks again.